Welcome to Hometown Healthcare. You can find us at hashtag Hometown Healthcare. And today I wanted to highlight a little bit of our founding, of where we came from, where we started. We actually started as a drugstore back in 1909 by my great grandfather. I am Charlie Barnes the fourth. My great grandfather was Charlie Barnes Sr. So interestingly enough, all the owners of this organization have had the same name. But anyway, he started out in 1909 in Valdosta, Georgia as a pharmacist. Was actually originally licensed by the state of, or I wasn't even the state, the city of New Orleans. And then he became licensed in the state of Georgia when he moved here. Interesting thing, if you see a picture of that operation, is you notice cigars and cigarettes, and you notice the soda fountain. One side is tobacco products, the other side is the soda fountain. It's a really neat setup. Back then, you really didn't have much regulation. There was the first drug law that was passed in 1906 that started some regulation. So everything was over the counter. One thing that was interesting about the time was the story that gets passed down to me from my father is the soda jerk at the time, the person that was basically dosing or flavoring the compounds that the pharmacist was making in the back. So you could sit up at the bar stool and take your dose of medicine with a little Coca-Cola on top of it. That soda jerk was such an important person that after working under the pharmacist for 3 months could become a pharmacist himself. So very prestigious role. It was a very different time. And he ran the organization all the way through World War II. And in that time, he actually became postmaster for a little while, for I think about 8 years, and focused on that. And we were in that role, he actually helped to promote Valdosta, and some of the early imagery of Valdosta, historically speaking, all comes from him. So we really love Valdosta and being locally from here, and the things that he was able to accomplish. We were in 3 different buildings when he was the owner, all in downtown Valdosta. The first building actually was called Vincent Barnes. We were a partnership. That only lasted for a year. Partnerships don't last long. Apparently. So then he moved out and had another office on the same block, basically, and then moved a little ways away to the hotel called the Patterson Hotel. We currently are in the same exact address as we were then. We were in it from 1913 to 1952, in that spot, which is in the Patterson Hotel, right behind the railroad tracks. And so interesting enough, since we've been in this location, we've been here for about 75 years. So he was a phenomenal man and did a lot for the community. And he was also from New York, which is a little interesting in itself because he came down in the early 1900s, and Northerners weren't as welcomed in the South, even at that time period, because we were so close to the Civil War. So very proud, very big heritage there, and I think that's interesting. And we really get our roots there, and in what we do and how we do it. Another really important facet that he did was, if you think back, no regulation. He competed with the physicians. He never once in his whole career as a pharmacist filled one prescription written by a physician. If someone would come in with a written prescription from a physician, right down the way, he'd rip it up and say, "Hey, I got something for you that's going to work better." So they were kind of competition in a way. Physicians, they compounded their own things as well. Everything was compounding back then. We didn't have the condensed pills, oral pills that we have today. Mostly everything was compounded in some way or another. So whoever had the best customer service and the best outcomes, of care, they were the ones that they got the business. So it was a really interesting time. Obviously, we've changed a lot since then as we move forward, and our vision at Barnes Healthcare is to transform healthcare. And some of those things that they were doing back in the early 1900s are some of the things we want to be doing today and tomorrow. So it's great to reminisce on those times. So thanks for tuning in to this episode of Hometown Healthcare. Again, you can find us on social media, hashtag Hometown Healthcare, and see you again next time. Thank you.